During a hospital stay, many patients will require assistance from providers to facilitate their mobility. That assistance could be helping a patient roll, reposition in bed, or dangle at the edge of the bed. Different patients will require different levels of assistance, and as healthcare providers, it is our responsibility to provide that assistance to patients in a way that is safe for not only the patient, but also for ourselves as providers. This video will demonstrate some simple patient bed mobility techniques for those requiring varying levels of assistance. It will also highlight important body mechanic strategies to ensure the health and safety of everyone involved. When a patient is positioned too low in the bed and is unable to position themselves, you will need to scoot or boost them into a more appropriate and comfortable position. Begin by lifting the bed to waist height. Then put the bed into Trendelenburg position, which is where the head is positioned lower than the feet. There is a button at the foot of the bed specifically for this. This will allow gravity to help you as you boost the patient to the head of the bed and minimize any strain on the provider. Ensure the patient's pillow is under their head before you begin. Have the patient give themselves a hug. Both providers should grasp the sheet at the patient's waist level. Position yourselves with a wide stance to provide a strong base of support, but stand above the patient, closer to the head of the bed. When you lift, you will shift your weight onto your leg that is nearer the head of the bed. Count to 3. And you should both simultaneously shift your weight onto that leg as you pull the patient toward the head of the bed.
1, 2, 3.
With the patient appropriately boosted, lower the bed to its lowest position and ensure the patient is comfortable before exiting the room. In patient care, there are a number of instances where the patient will need to roll to one side of the bed, maybe to change the sheets of the bed, or to provide treatment, or perform an assessment. Some patients will be able to accomplish this without assistance, but others may need varying degrees of assistance from a provider. If a patient has some ability to move in the bed but requires support from a provider, utilize this technique. Begin by raising the bed to waist level. Bend the patient's opposite knee and have the patient reach across their body with the opposite arm to grasp the bed rail towards the side they are rolling to. You will provide guidance and support for the roll from the scapula, or shoulder blade, and from the bent knee. So place a hand at each location. Then position yourself with a wide stance that provides you a strong base of support. Count to 3.
1, 2, 3.
And aid in facilitating the roll through support on both those points of the patient's body. When you need to help the patient return to a supine position, provide support at the scapula and knee and simply guide the patient as they roll to their back, and extend the leg. For a patient that requires more assistance with the roll, you can utilize this technique. Again, begin by raising the bed to waist level. Cross the patient's opposite leg at the ankle. Reach the patient's opposite arm across their body. Again, position yourself with a wide stance to provide yourself a strong base of support. Use the sheet to assist the roll. Take hold of the sheet at the patient's waist level, and shift your weight back as you roll the patient toward you and onto their side. To return the patient to a supine position, you could use the sheet to assist if necessary, or provide support at the scapula and knee as you allow the patient to roll to their back. Then uncross the legs. If you have a patient that needs some assistance to sit at the edge of the bed, follow these steps. Use the bed to your advantage by lifting the head up a little bit and lowering the bottom portion to flatten the legs in the bed. Utilizing similar technique to assisting a patient with rolling, lift the opposite knee and have the patient reach across their body with the opposite arm toward the side they will be sitting. Roll the patient while supporting at the scapula and bent knee. With the patient on their side, help the patient bring their legs off the bed. Then instruct them to push up with the elbow or arm that is against the bed. You can help guide and support the patient with a hand on each shoulder. To get the patient back into bed from this position, first lower the head of the bed. Then instruct the patient to slowly lower themselves onto their elbow and then their shoulder. You'll guide them down with your hands on both shoulders. Then lift their legs back onto the bed and assist them as they roll onto their back. If you have a patient that needs a lot of assistance to sit at the edge of the bed, follow this two-person technique. Use the head of the bed to your advantage by lifting the head up and flattening out the bottom portion of the bed to flatten the patient's legs. One person will assist the patient with their upper body, and one person will assist the patient with their lower body. One provider will begin by bringing the patient's legs off the edge of the bed. Ensure that both the patient's heels are completely cleared of the edge of the bed. Both providers should position themselves with a wide stance to ensure a wide base of support. The provider controlling the patient's lower body will assist the patient by grasping the draw sheet on either side of the patient's waist. The provider controlling the patient's upper body will assist the patient by grasping the sheet underneath the patient's shoulder blades. Before you reposition the patient, either ask or help the patient to position their opposite arm across the chest, similar to the technique used for rolling a patient. Both providers will assist the patient to the edge of the bed by weight shifting the patient's hips forward and the trunk upward via sheet assist. The provider controlling the patient's lower body will use their knee to block the patient's legs and prevent the patient from sliding off the edge of the bed. The provider controlling the patient's upper body can assist the patient by providing support and stability to the patient's back. To return the patient to a supine position, lower the head of the bed. Then work together to safely and slowly guide the patient down onto their shoulder. Lift the patient's legs onto the bed and guide them as you roll them onto their back. When mobilizing a patient out of bed, such as transferring or ambulating the patient, the gait belt is an invaluable tool that can improve both provider and patient safety. But before you use a gait belt, you first need to know how to apply it. Whenever you apply a gait belt to a patient, follow these steps to ensure proper placement. Let's begin by looking at the clasp on the belt. When applying the belt, the clasp will always be on the outside, facing away from the patient. To use the clasp, lift it up. This will create an opening to insert the end of the belt. If the clasp is not lifted, the end of the belt cannot be fed through. Lift the clasp and feed the end through the opening. Hold the clasp open while you continue to feed the belt through to the desired tightness. Once you achieve that tightness, press the clasp down firmly to ensure that it locks. Do not just release the clasp. It may feel like it will hold the belt in place, but it is not locked in place unless you firmly press down on the clasp. When applying the belt to a patient, ideally, the gait belt should be positioned around the patient's waist. That's below the ribs or breasts and above the pelvic bone. But be mindful of any restrictions the patient may have, such as fractures, tubes, lines, etc., where you may need to alter the placement of the gait belt. Lift up on the clasp as you insert the end of the gait belt. Feed the belt through the clasp until you reach the desired tightness, which is 2 fingers between the belt and the patient, and firmly press down on the clasp to lock it into place. You want the belt to be snug, so it does not rise up on the patient during use.